Today we are going to do psychotic disorders, and the first psychotic disorder that comes to mind is schizophrenia. Schizophrenia is a serious psychiatric disorder. It is a disorder where the patient loses contact with reality. They cannot make contact, they cannot make interpersonal contact, they cannot relate, they cannot react to, they sort of move into their own psychotic world. And this psychotic world is filled with delusions, paranoid delusions. These are beliefs outside of reality. The state is after me, they want to kill me. And these delusions, these contents of thought is fixed. You cannot persuade them otherwise, and there's no possibility, no substance in reality. So they move into their private delusional world away from reality. And add to that they perceive noises, they hear voices, they see things, hallucinations. And these hallucinations, these voices will give them commands, and they will react to these commands. They often tell you that I am controlled from outside, I am controlled by the state, I am controlled by these voices. That is a psychotic, delusional world of hallucinations. And they are removed. And if this illness relapses or goes on, becomes chronic, there's a deterioration of person. They become empty, their emotions and mood becomes flat, non-existing. There's poverty of personality, there's poverty of thinking. We call this residual schizophrenia. So this is a serious psychiatric disorder. And we need to diagnose it early. There are different forms of schizophrenia: the paranoid schizophrenia, the disorganized schizophrenia, the catatonic schizophrenia, undifferentiated, and then the chronic form where there's residual damage. There's a thought process disorder, and these people become isolated from the real world. They drop out of school, they drop out of work, they become what we see night people, and there's no proper reality contact anymore. A lifetime prevalence of schizophrenia is 1%. 1% of our community have schizophrenia. The suicide risk is 20 to 50% of people with schizophrenia attempt suicide. The cause of the illness is not so innocent, no. 5 to 10% of them have a good outcome. And it seems to us in schizophrenia that it's the first 5 years that will dictate the outcome. If there are no relapses within the first 5 years, they have a good outcome. But if they relapse in the first 5 years, 50% have a poor outcome, and eventually, in the very end, the patients, 60% are significantly impaired. Some people would say today in academic psychiatry that there's broadening along the fourth ventricle, that there is a degenerative process going on in schizophrenia. So these people need to be diagnosed early. Some academic people say we need to reward them for taking medication, and we should be advocates for depot medication, an injection that would last for more than a day. Injections that would last 2 weeks or 2 months. So the other psychotic disorders is schizophreniform disorder. Because the prognosis and the outcomes of schizophrenia is not that good, we will only diagnose schizophrenia after 6 months. In the first 6 months, we call it schizophreniform disorder. Then there is the schizoaffective disorder. This seems to me a mixture of bipolar and schizophrenia. The bipolar and schizophrenia share genetic predisposition. And sometimes one finds it very difficult, especially in adolescence, to differentiate between what is bipolar and what is schizophrenia. We do not like making that diagnosis, otherwise it will become a basket to put any psychotic disorder in. So we try and hang in there and not say this is merely a schizoaffective disorder. Delusional disorder is also a chronic psychotic illness like schizophrenia, but the functioning, the residual damage is not that bad. They also have very little hallucinations, or it's absent hallucinations, but they've got this fixed delusion that would separate them from reality. Then we get brief psychotic disorder. That is where people have a severe stressor. Some people will develop post-traumatic stress disorder. Some people will develop a short, brief psychotic disorder as a reaction to the stressor. Cultural bound syndrome, difficult one. There are cultural bound syndromes where the culture will recognize this as a culture bound syndrome and not a psychiatric illness. It is very difficult for me as an outsider to recognize what is culturally bound syndromes and what actually is schizophrenia. Therefore, we need the true traditional healer to help us to recognize and differentiate between a culture-bound syndrome and a what we would call a functional psychosis. And then psychotic illness can also be caused by a physical illness. For instance, neurosyphilis can give you a psychotic disorder. HIV infection can give you a psychotic disorder. Therefore, again, the psychiatrist has to sort out, isn't this an infection by neurosyphilis or by HIV, so that we can then treat the psychosis and treat the infection. And then the huge pain that we have in psychiatry and in the community today is a substance-induced psychosis. The substance-induced psychosis is a huge community dilemma. Young people are going down the drain. There are many, many drugs, illegal drugs. Cannabis is still an illegal drug. Mandrax is an illegal drug. Cocaine, heroin, TIC, the methamphetamine problem that we have. These drugs are very, very addictive. Some people say if you take one shot of TIC, you want the next one. It is that addictive. So these illegal drugs are a huge challenge to us because it damages our children. They have long-standing cognitive deficits. They don't function at school. They drop out at school. And they need ongoing treatment. And they need addiction rehabilitation and the treatment for their psychosis. There are legal drugs. There are legal drugs. The big one is alcohol. And alcohol can not only destroy the family by addiction, repeated intoxication and withdrawal, and the family discord and the work, and alcohol addiction destroy the family. But alcohol can also cause a psychotic syndrome, can also cause and the psychotic syndrome is mainly a one of jealousy, where they become so jealous of their spouse that they can physically and emotionally abuse these people. So even alcohol, which is a legal drug, can cause a psychotic illness. To wrap up psychotic illnesses is that, yes, it is part of our community. Yes, we have to treat it early. Yes, we've got to be advocates for depot medication. Yes, we've got to treat the comorbid addiction, the comorbid trauma. It is important for us to accept this. Psychiatry is still something that we sometimes do not accept. It's something that we want to wish away. It shouldn't be part of medicine. But illnesses of the brain is part of medicine. And anyone who willingly enters into the pain of a stranger is a truly remarkable person. Henry Nouwen said. I thank you.